We began the year 2020 in a global fight against an enemy mankind had never seen. And every day since, the brightest minds in bio, science, and medicine have acted together to limit the spread of the novel coronavirus SARS-CoV-2. Leading the battle in San Diego County is our public health officer, Dr. Wilma Wooten. I sat down with Dr. Wooten recently for a rare, in-depth conversation about her role, the efforts to save lives, and the background battle coming from some of those opposed to state policy. January 30th, 2020, the World Health Organization declared the outbreak of novel coronavirus a global health emergency.
They're global, but it doesn't take very long for things to move.
Public Health Officer Dr. Wilma Wooten mobilized. Her job was to try to control the outbreak among San Diego County's almost 3.5 million residents.
Because we knew it was coming.
I met up with Wooten at the county office where she has worked for over a year now, coordinating the pandemic response. She tells me as millions of human-to-human transmissions pushed the virus to our coast, she headed a two-pronged charge to save lives.
This is where we have sector call meetings. You can't operate in the moment. You have to plan for the future. This virus is throughout the county.
She declared a local emergency, which activated government resources and expanded the county's Live Well partners into a team of business, government, schools, faith, and community organizations, as well as our healthcare systems, all coordinated out of these offices, which she is showing to the media for the first time.
Everyone working together for a common goal. That is the definition of collective impact.
While Wooten stresses it's a team effort, month after month, every afternoon she informed the public on our daily case rate and lives lost.
Once we get the information, we act as quickly as possible.
She says the scariest moment was November and December of 2020 when ICU rooms were at or above capacity.
That was very concerning. It was very, very concerning.
But Wooten describes what happens next as a miraculous thing. Vaccines started going into arms and the number of cases leveled off. But even so, state COVID restrictions remained in place.
We were just trying to do the right thing for our community to keep our residents safe, and that really is the bottom line.
But Wooten has paid the price, with San Diegans angry about those restrictions. What do you think was the biggest struggle you faced with this?
I think by and far the biggest struggle was to get the mean emails and phone calls and snail mail from the general public. Now that's something I had never experienced before.
Protesters even showed up in her neighborhood.
While I still, charged on and did what I need to do from day to day, that was scary. That was very scary.
Public health officers around the country received death threats and threats to their families. Some walked away, but not Wooten.
Failure is not an option, and if I'm going to quit, it's going to be on my terms. And not because someone is threatening.
Wooten's work ethic is evident. Her first day off was 10 months into the pandemic. And while she is often the serious face of a grave situation, we saw a lighter side when the subject turned. When asked how she feels about being a role model, she says she's glad to play a part in blazing a trail for all young girls.
But I'm doing my job, and if doing my job serves as a role model, then that makes me happy.
For Wooten, it was a physician who talked to her in the 9th grade in her hometown in Alabama who she credits for changing the trajectory of her life. She made a decision. She was going into medicine. What did Mom say?
Well, I can actually tell you, my mom said to me once, "Well, don't you just want to be a nurse?" And I said, "No, Mom, I'm going to be a doctor."
From medical doctor to public health officer, and still, Mom knows best.
Oftentimes, I tell my mom that she's the doctor in the family because she always has the solutions and the remedies, and she doesn't listen to me as the doctor, so it doesn't really hold a lot of weight for her. I know she's proud of me, but yeah, she's the doctor of the family.
I want some of those home remedies, by the way. A laugh after a year holding her breath and not getting a lot of sleep, something she plans to catch up on after the first of the year if all continues as planned.
Oh, probably travel somewhere to a tropical region that's warm.
She loves to sail, and wherever she goes, there will be water.
You come to a centered place where you are very content. It's a feeling unlike none other for me.
And Dr. Wooten believes we are at a turning point with the 16 and older being vaccinated, but she stresses we still have a lot of work yet to be done. Her message to the public: vaccinations are our path forward out of this pandemic. She says the more people who get vaccinated, the more we can return to our normal way of life.